Doctors of Reddit, what's the worst case of patient ignorance you've come across? Not a doctor, but a paramedic. Had a lady call 911 for foot pain. Got there. This lady had advanced gangrene to both feet to the point that they were turning black and had that unmistakable smell of gangrene. She told me that she had some cuts on her feet and had been applying lotion. Like Jergens type lotion, not antibacterial stuff, to her feet and then had been putting slippers on them. She was honestly shocked when I told her that she could lose her feet and possibly her life. The smell was so strong that I could smell it when I entered the house. I has a similar patient once. One foot had area about 6 by 6 centimeters that was black at night. Pitch black. I was a surgery intern on call that night and spent a few hours gently debriding this wound, that least what I could, at bedside. No anesthesia needed, all dead. Infected tissue. Guy was in the hospital for months getting debridements in the OR followed by backpack. Miracle. Treatments. Many people wanted to amputate but we stuck it out. When the final backpack sponge was removed, it was beautiful pink tissue and the foot was salvaged. I was proud of that. These people need to control their DM and take extra care of their feet for God's sake. Corman here. Had a Marine come into clinic on Monday for abrasions to the hands on Friday. His hands were dirty AF, which begged me to ask if he had washed his hands at all to clean the wound. Marine, I thought that was your job. The wound was gross and starting healing over the dirt and grime. Ended up debriding the wound, which is very painful and basically tears the old dirty skin away to clean the wound. Edit. Basic common sense of hygiene is surprisingly not common, especially among Marines. Lol. Pet here. Once working in the RI was brought a septic 6 days old newborn. He had a weird stinky thing over his umbilical cord. The mother said it was a popular remedy to make the umbilical cord fall faster. It was made from horse manure, spider webs and some plant. I lost that baby. Does the law get involved with this kind of thing? Sounds like a child neglect abuse case. Just awful. Just plain ignorance. That happened in a public hospital in a suburb of Sao Paulo, Brazil. Very sad. I will never forget the look on the mother's eyes when she realized that remedy was the cause of death. Septic at 6 days old. For no goddamn reason at all. My nephew is 4 months old. Currently sleeping in the room next to mine. And I just wanna go hug him for a bit now. Doc here. I had a patient come in with tumors in many parts of his body. I'm not an oncologist. He came to me for an unrelated issue. But his shirt was bloody in several areas where the tumors had ulcerated through the skin. Judging by his chart, all his other docs had tried to get him to get biopsies done and see a specialist, and he always adamantly declined. His reasoning was that he believed an electrical device was the cure for his cancer and that the entire medical community was completely wrong. He had a manual for this electrical device with color-coded tabs and he practically had the thing memorized and was trying to convince me that it says XYZ here, which indicated it may be able to help with his condition. I tried, like all those before me, and failed. My aunt died of breast cancer because she tried to pray the disease away. She was diagnosed, and it was treatable, but she declined treatment and put herself in God's hands. I tried arguing that God had put the doctor in her path for a reason, but she was having none of that. That makes me think of the story of the guy during a hurricane. The newscasters say people have to evacuate. Guy says that God is going to save Hi Monsieur. Storm starts rolling in. Neighbors offer to take him. He says no because God's going to save Hi Monsieur. Starts flooding into the house. He is on his roof and when someone comes by in a boat he again says no, that God is going to save Hi Monsieur. He ends up drowning and when he gets to heaven asks God why he didn't save Hi Monsieur. God's response: I told you with the news. I sent your neighbor. And I sent the boat. I've heard the same thing with a flood. I sent 2 trucks, a boat, and a helicopter. What else did you want? Quote, I had a sad one happen to me. I saw a patient with very advanced colon cancer, who was convinced that she was misdiagnosed. She had gone to multiple doctors who told her she had cancer, using blood test results, imaging, and biopsies to back them up. But she was sure that we were all missing something. She had brought in a copy of her official pathology report with the results of her biopsy. She was so excited. Look, doctor, they told me it was cancer. But I've been through this report over and over, and it doesn't say *cancer* anywhere. Quote, the whole report had carcinoma plastered throughout it. Medical lingo for malignant cancer. Would it be feasible to tell her that she has carcinoma and treat her for that? But then don't use the word cancer around her? Although the moment she Googled, she would have seen that carcinoma means cancer. I feel like this is not a person who Googles anything anti-vaccine. Real talk. Parents who don't get their kid vaccinated should be charged for murder should their kids fall victim to the disease. Yes, you can refuse the vaccine, but children should have the right to common vaccines. Hep A and B, polio, tetanus, etc. Nothing crazy fancy, but a select few vaccines which we know will keep them somewhat safe. If their kid gets the disease and is treated, parents are fine or serve community service, and the children are educated and allowed to make their own vaccination choice. This needs to be higher up. There's been quite a number of parents refusing to let their children have vaccines or take medications, and the illness and deaths that result are always a tragedy because it's so preventable. Saw a patient that had a hernia the size of a large pineapple. Basically all of his intestines were in his scrotum, monsieur. Greater than basically all of his intestines were in his scrotum, monsieur. Well, that's the worst sentence I've ever read. Must have taken a lot of guts for him to fap. There's an episode of House where a dude says he's feeling pain everywhere. He pokes his face, his arms, and his stomach and says it hurts everywhere. House then looks at his finger and it turns out he has a broken finger. I thought that was hilarious. My cousin, who's a doctor, said she had a patient who did basically the same thing. Not a doctor, and I've posted this before. I worked for an optometrist and a patient came in for a routine eye exam. When she checked in, the left half of her cheek eye was covered under a loose band-aid. Under the band-aid, her face was completely eaten by cancer. I could see the flesh hanging from her cheekbone, it was so deep. I looked at her chart shortly after, and this had been going on for years with the doctor's note. Still waiting for God to heal cancer. The oddest part of it all was she would only try on designer frames from the optical and insisted she wanted high-end frames. Lady, no one is going to be looking at those frames. I always thought that, if anything, doctors and evolving medical technologies are God's ways of healing. So I'm always perplexed and sad for these patients. Yeah, why do doctors and medicine have to be at direct odds with God? At least I can get on board with people who thank God for putting smart and effective medical care in their paths. I mean, that's somewhat respectable, because God also spent a couple hundred millennia not putting modern medical technology in front of cancer patients. These "God will heal me" kooks are a lot more logically consistent when it comes to mixing theology and medical advancements than the people who say modern medical tech is God's will. What? God just changed its mind about how cancer should go in the past century or so. Sorry about all the pain and suffering everyone who lived before that. Touché. Saw a guy came in with AR hemisphere stroke, completely paralyzed on his left side. Symptoms started 2 days ago. I asked him why he waited so long. He said he thought he slept on it funny, so wanted to wait a day. Unfortunate too. He had a big clot in his RMCA artery. Probably could have fixed it if he had shown up earlier. My friend who is a nurse told me a story about a woman who had surgery that basically left her with tunnels in either side of her abdomen that had to be carefully cleaned and rinsed out to prevent infection. She came back to the hospital a week later with maggots inside her wounds because she didn't ever clean them or take off the original bandages. My nurse friend had to pick them out and rinse out the holes repeatedly. How the fuck do maggots even get in there? What type of fucking dirty person must someone be for this to happen? Oh my god. Flies. Flies land, lay eggs. Maggots hatch. The entire life cycle from fertilization to death for flies only takes a week. So if you live in an environment that's infested with flies, it'd only take a day or two. Just yesterday I got a call for chest pains. Show up on scene and the dude meets us at the ambulance. Hops in and we start assessing him and his chest tightness. Sir, do you have a past cardiac history? No, I don't think so. Lifts up shirt so we can do a 12 lead and see a scar from a CABG. Sir, are you sure you don't have any cardiac history? What's this scar from? Quote, oh, I'm not sure, my wife might know though. Probably, she also knows what medication he takes. He just knows he takes the white ones. And a doctor should know which ones he means. What kind of medical history do you have? Oh, I don't really think there's anything. Wife opens the door and hands us a literal gallon bucket filled with meds. This guy was also 52. Completely alert and oriented. Big but not morbidly obese. Just doesn't pay attention to his health or anything about his care. Not a doctor but a massage therapist. I had a client come in with boot on for broken leg. He was adamant that I help him remove the boot and do deep tissue massage on it to help with the pain because he didn't like taking his painkillers. If they were opiates, I get where he's coming from. First patient I saw as a medical student presented to the ER because, as he put it, my nipple fell off. Very nonchalant. Turns out he'd been watching his left breast get bigger over a period of months until the underlying tumor finally eroded through the skin, causing said nipple to fall off. Male breast cancer is more common than most people realize. Check your breasts, boys, and your balls while you're at it. Too many men wait to get medical care. I met a man who had cancer of the rectum. He was bleeding from it for months and didn't see a doctor because it was embarrassing. I had a woman with a fungating breast lesion. Don't Google it. Who presented to Emerg for a sore. It was about 20 centimeters across. She wanted us to put antibiotics on it. That was less ignorance than denial. She got angry when we tried to redirect her towards reality, and left screaming at us. I still will think about her. Sad case. Greater than don't Google it. Oh dear God. Greater than don't Google it. God damn it, I should have listened. Jesus. Carrot, listened, not Googling. 'Twas during my internship in a public hospital and a multi-gravid patient came in for labor pains at term pregnancy. Fetal heartbeat was checked and confirmed through ultrasound because it was undetectable. Sadly, the baby wasn't really moving at all and no heartbeat was appreciated. Baby was delivered through normal delivery, weighing about 3.5-4 kgs with no deformities. Full-term baby. Baby didn't make it. Mom was known diabetic and was not compliant with her insulin. If the reason was anything like I didn't want to take chemicals because they're dangerous for the baby, I'm going to die a little on the inside. I'm really not sure if she couldn't afford it, considering we're in a poor country. But she thought her baby is still okay since it was getting bigger. But at first she didn't disclose that she was diabetic. We asked her again, and that she said she was diabetic with previous pregnancy. This was her 7th or 8th pregnancy. I think she knew well enough she needs the insulin. My mom is a nurse, so this is second-hand. Pregnancy woman is admitted for severe dehydration. My mom is a nurse and apparently their first interaction was something like, "Mom, the doctor said you're very dehydrated and we need you to drink at least X amount of water before you leave." Patient: "I don't drink water." Mom: "Your baby is becoming stressed and you should try to drink as much as you can for your baby." Patient: "I hate water." I only drink soda. Rest of the day she basically refused to drink any water no matter what anyone else said to her. This might have been my sister. She refused to drink water. Even during her 3 pregnancies, she would drink soda, sweet tea, or Gatorade, if she was feeling healthy. She now suffers from chronic kidney stones and has been in the hospital about 10 times in the past year for the monsieur. She says she drinks water now. That is terrible. My BF has chronic kidney stones. He used to get them yearly but has lost weight and is trying to be overall healthier, and his last one was 2 years ago. And they are pretty debilitating. For her own sake, I hope she really is drinking water now. Thank you so much for watching and have a good day.